beautiful shot of Carlsbad there, just south of there. There'll be a big event coming up on Thursday. Solana Beach. It's May. May is Melanoma Awareness Month, and joining me this morning to talk about it is Dr. Melanie Palm. Good morning to you.
Good morning, David.
It's a very important event because people sometimes just don't think about this form of cancer much.
Yeah, and we live in sunny San Diego, and so we're seeing a lot of sun exposure, and I want my patients and the community at large to enjoy the wonderful weather we have, but be really responsible about things, and that's what this event is all about.
Boy, the statistics, 1 in 5 Americans will develop skin cancer in the course of their lifetime, and melanoma, of course, is the most serious form of it.
It's the one that we get the most concerned about because it can be fatal. You know, it can look like a little innocuous black freckle or something that you've noticed for a short period of time, but if it's undiagnosed, then it can spread to other organs. It's the one that we as dermatologists, it sort of sends off the alarm bells and we want to get a hold of early.
When you do a screening, and perhaps people can even do this at home to some degree, what is it that really points out that you may have an issue?
Well, we talk to patients about the ABCDEs of changing moles. So if something is asymmetrical, that's the A. The border is irregular. Color, if there's several colors or it's really dark, black, blue, white. If the diameter is larger than 6 millimeters, and then E is evolution. That's the biggest one. Something is new or changing, becomes itchy, painful, bleeds, something just doesn't seem right, or it's the ugly duckling. It's the one that doesn't look like the rest of you. It's something you want to get checked out by your dermatologist.
That is a key. If something has changed on that mole,
absolutely,
then you at least want to get it checked out.
Yeah,
right?
And it's a good idea to check yourself once a month, and then once a year see a board-certified dermatologist for a skin check.
You say melanoma is the most deadly, but it can be avoided, first of all. And then, if not avoided, it can at least be caught early. There are some things you can do.
So believe it or not, over 90% of melanomas are related to UV exposure, sunlight, and tanning beds. We now know that definitively tanning beds and the UVA exposure can lead to melanoma. Having a history of sunburns, light-colored skin, light-colored eyes, being able to freckle, having a history of sunburns over time really greatly increases your chances. So that's why I like to talk to patients about good sunscreens, things that contain zinc oxide in them, and really protecting yourself when it's very, very sunny days like we're having this week.
Yeah, it seems so obvious. Just put sunscreen on, but you don't do it every day. You should get in the habit of doing it even on a cloudy day.
Yeah, I tell patients almost like getting oil changes for your car or grooming yourself. You want to get in the habit of addressing the sunscreen and just making it a part of your daily habit, putting it on, 30 minutes before you step out the door so it's there. Because even on cloudy days, which we don't have that many of, you're getting still 80% of the sun exposure, so you really do want to protect yourself.
But there are a lot of forms of sunscreen out there. You see the numbers on the SPF numbers. What is a good number to go by?
Sure. So the FDA just came out with new regulations. You want to get at least 15, and it should be broadband, meaning it covers UVA, which are sort of the aging UV, and it relates to melanoma, and UVB, which causes us to burn and causes our skin to age in some ways as well. And so if you look at some of these sunscreens, I really encourage patients to get a physical sun-blocking agent, the ones you can pronounce, zinc or titanium, rather than some of the chemical sunscreens which work a little bit differently. But I like at least a 30 or above. Once you go beyond that, you're not getting that much more coverage.
Isn't it amazing? 20, 30 years ago, people used to put oil on there.
I know. I get a lot of stories from patients.
To get sun.
Reflectors with the iodine, and there really isn't such a thing as a healthy tan. Tan is a way of your body's defense mechanism against sort of cellular damage, so you do really want to be careful.
Is there a safe way to get, I know women concentrate on this more than men, is there a safe way to get that tan? Are the rub-on tans, the machine tans? What's safe, what's not?
Spray-on tans are fine. The spray-on tans are just fine. We just don't want people in tanning beds or UV exposure. There's a reason that a majority of states now are actually regulating tanning bed usage because we know it's a known carcinogen.
Okay, so coming up Thursday, tell us about the event.
Yeah, so Thursday, May 1st from 5:30 to 8 at my practice, Art of Skin MD in Solana Beach, California. We're doing our 4th annual SolSearch. We're raising money for the Skin Cancer Foundation. We're going to have a fabulous band there. We're expecting over 200 people. We're having catering by California Pizza Kitchen and Food Sense and Crush Restaurant. There's going to be tons of prizes. We're raffling off a guitar by Daughtry, and we're also going to have a $2,100 electric bike there, among other things. I'm raffling off about $10,000 of services as well.
And you have some of these products as well.
We do, but it should be a lot of fun. We really like to celebrate the fact that we do have healthy skin in San Diego and want to bring awareness to the community as well.
Okay, Dr. Melanie Palm, it's at your place in Solana Beach, and they get more information where at?
They can look at our website, artofskinmd.com, or call us at 858-792-7546.
All right, thank you so much.
Thank you.
Appreciate it. Today is